good morning or good evening or good afternoon, depending on what part of the planet you are signing into this. Paula Nutting, your musculoskeletal specialist, and this month, which is November, on my Ask Me Anything guest, I'm so excited. I'm having a little fangirl moment because Dr. Perry Nicholson is one of my all-time most amazing, fabulous practitioners. He has been around in the space of fitness and then in body work. He's a chiropractor by trade for decades, and the stuff that he has got to offer is absolutely incredible. So much quality and knowledge from him. Also, I'd like to do a quick shout out to 𝘂𝗶𝗀𝗃 because 𝘂𝗶𝗀𝗃 is our Queensland-based educational space. So it's educational remedial massage for myotherapists, and we're building a space for an associate degree in there too. So if you're thinking about doing a course in remedial massage or upskilling to myotherapy, or just wanting to get a bit of an idea on what an associate degree looks like, I want you to contact the guys at 𝘂𝗶𝗀𝗃 just to ask them a little bit more information and send out how you can become a better therapist. Anyway, with no further ado, I want to see if we can get Perry to come on in, and we're going to have a great hour of chinwag and to hopefully answer some of your questions, guys.
Hey, Paula. Hi, everyone. So great to see you, as always.
Yeah, I'm so excited. I'm like, yay, I'm so excited we got Perry. You're a hard man to get hold of, my friend. You are so busy.
Well, I'm so glad that you did. And, you know, same for you. We just love what we do, right? It's just always going, always on the go.
Yeah, totally right. So the three words that come into mind, you pop in when I put either the vagal nerve, lymph system, and the fascial system. That's like, if I was going to wrap you into a ball of three words, they're the words I'd put together. Have I missed anything?
No, that's pretty good. I'll take those top three. Yeah, without a doubt. Yeah, they all work. They work really well together. And they always work together, by the way.
Forever. Yeah. When we were
always.
We would always. I was listening to a podcast or webinar that you were invited to talk to about the vagal system and stress and your client and patients. And it intrigued me because there was a lot of stuff that you talked about that I thought was valuable for therapists, because we treat patients when they come, or clients when they come in to see us, and a lot of us don't consider more than just the muscles.
Right.
Yeah,
so, maybe that's a great place to start, honestly, because a lot of these issues that people have with their autonomic nervous system, which is your sympathetic nervous system and your parasympathetic nervous system, they will usually end up manifesting their end results in the muscles. So working with the muscles will actually help your autonomic nervous system at the same time, right? Because everything is interconnected.
Yeah. How much do you think is the bottom up versus the top down? Because I always think that top down is like, a lot of people go, let's just think about, obviously, breath work. But what can we do at a tissue level? Is there much?
Yeah, honestly, I really think that they both have equal value. It's a two-way street. That's the, let's say when you're working on the peripheral part of the body, that's going to be your afferent, ascending, the sensory input going up into the brain, right? And then the brain will interpret that information. I call it information and data because that's really all it is. And then you'll get the output, the efferent, the exit part, going back down. And so they both have equal weight, because you can have an issue with the brain, for instance, with like a lot of neuroinflammation or prior patterns that you're locked into on habits and behaviors or pain over the course of your life that will influence the interpretation of all those signals that you just did to somebody's musculoskeletal system, which will influence what comes out. But if the brain has inflammation, you kind of, you'll have an issue with the output, especially with pain. But people can also have an issue with the input signal. You know, they have not enough sensation somewhere, too much sensation somewhere, loss of sensation in one place, or, you know, if you don't use it, you lose the kind of thing that happens. So I think where people really fall apart, if you will, is that they try to look for one as more important than the other. And I really think that they're both equally important.
Really good point. And the reason that I'm saying that is that we have massage therapists who go, I don't think I'm doing any value. But in actual fact, the second we put a hand on someone with empathy and mindfulness, we're already making change, right?
Oh, absolutely. I think so. I believe that there really can be no healing in healthcare without touch. I've always thought that, you know, and it's the touch is more than your technique. I mean, that's going to be great if you have that, but you all know it if you've experienced it yourself, the difference between one practitioner's hand compared to another practitioner's hand that may have had the same exact training. It's the intention behind the touch. It's the empathy behind the touch that you mentioned before. And it's looking beyond the touch to the human being that you're impacting with your touch. And you learn through experience to you look far beyond where you're actually touching, right?
Yeah.
But it's also that the visualization underneath, that 3D visualization. That's why I think knowing your anatomy is so critical, because, you know, when I do it, I actually see things moving and changing and communicating when I do that. And I think everybody who has any healthcare issue whatsoever should get soft tissue massage therapy type work of many different types. And unfortunately, it's really not as common as we think it is, because we're in that world. So we just naturally think that, well, everybody else must do this too, right? But they really don't. And if they do, there's no guarantee they're going to come across a good one.
Yeah. Isn't that hard to train? That's one of the hardest things to train. That course I was talking about, the modules, part of it for the teachers is train your eye. And that's exactly what you just said. Look beyond the touch, because we see so much, like as an older, wiser practitioner, that we kind of go, all right, I'm touching there, but you automatically are sensing that they have gone into a different space. So their mind is actually going into, this is connected to my neck, or this is bringing up a past memory. So that, which brings our limbic system right in, I guess.
Yeah, absolutely. Well, you know, touch is a major part of how, I mean, honestly, human beings, but other species, you know, communicate. And I've always said that you've never really done a proper treatment or a proper assessment or exam, if that's in your scope of practice, until you put your hands on someone, felt the tissue and seen the reaction to their touch, because there's things that you'll find by hand when you get good at it that you'll never find on blood work or an MRI or an X-ray, right? And there's also things that you'll be able to help a person feel in their own body that they're not going to get from a pill or a potion or a lotion or even nutrition. So all of those things are really valuable, right? But I'm sure you've experienced this, and many people who are listening, when you've worked with a client that suffered for a long period of time with chronic pain or a chronic illness, they feel like they're lost in the quicksand, they're in the abyss. The typical approaches are not working. And when you start to work on them, this almost like wall or shield begins to drop down. And very often it's extremely emotional experience for the client, and it certainly can be for the practitioner as well. But I think that that's what makes a hands-on practitioner so special, is because of that connection.
Yeah, yeah. And we've gone so far down that rabbit hole that I'm going to, first of all, anyone who's listening to this, if you've got questions or comments, please put them into the comments box, like the chat box on your Facebook, because we see them and then we can answer them. I haven't given any background of Perry, so for the people who don't know him, they're going like, they could be going, who is this guru? But they might need to know a little bit of background. So can you give us the, not quite the elevator pitch, but it's like, make sure it's a long elevator. Can you give people your background and where your passion is now?
Sure, I'd be happy to. Well, my business name and brand and everything that I teach right now is pretty much on my shirt for those that are watching. It's called Stop Chasing Pain. That's been my journey, honestly, since I first began in healthcare in 1997. Initially with traditional chiropractic. I've moved very far beyond that now, which I'm sure we'll talk about. But I always knew deep inside somewhere that there was more to helping someone heal and recover from chronic pain. Like I don't really go after acute pain. I'm the person you see when you've tried a lot of things that were supposed to work, but they didn't work, or they can't figure out what's going on, and you have to do what some might call out of the box thinking. But really, it's not out of the box. It's just that you really need to understand physiology and how the body works. Then it all makes sense. It's actually not outside the box. There has to be more to this than just treating the site of where somebody hurts, because whenever you do that, why does it always keep coming back? And it really frustrated me that all these techniques that you learned were things that were designed to be done to an area that somebody points to. And, you know, that's awesome. I mean, because honestly, sometimes that works, right? I mean, and people get better, and sometimes it doesn't come back, but that usually doesn't happen, or it'll manifest somewhere else. And I've always known the body is more spectacular than just to keep something on repeat. So I had to start thinking differently. And that's where Stop Chasing Pain came from. What that means is that we certainly treat pain, but we don't chase it. Chase it is where you'll just do something to wherever somebody points, or you'll do the traditional approach to whatever their label or diagnosis that has been given, because that's what you're supposed to do. But then I always say, well, what in the world do you do when what you're supposed to do doesn't work? Well, then you have to think better. You have to think differently. And my journey initially began where I was looking beyond the side of pain, but I was still stuck in the box, if you will, of the musculoskeletal system. I was still looking at muscle. I was looking at joints because I'm a chiropractor, right? And of course, fascia. So for instance, it was just a mind-blowing thing for me when somebody said to me, you know, your right shoulder can hurt because you have an issue with your opposite side hip. And I go, really? Like, I mean, it was just like the coolest thing in the world. And so then it expanded from there, but I was still in that sphere, that system. So I honestly branched out, and I began to look at all the parts of the body, not just the ones that hurt. But I knew there were further lessons that I needed to learn. And I only learned them because I ended up getting very, very sick along that journey with a lot of inflammatory issues, some people might call them autoimmune issues. And people always ask me which one. And I said, I think I had all of them, because it certainly felt that way. I never really had a definitive diagnosis. And I'm actually grateful for that, because sometimes that will pull you into the quicksand of your diagnosis once you get it. And then all of a sudden you get worse because you're supposed to have all these symptoms.
There's your label.
Yeah. But in essence, for me, it was just, I was inflamed everywhere. My musculoskeletal system was on fire, but my nervous system and my immune system were fried at the same time. So the reason I'm doing the stuff I do now is because everything that I had learned up to that standpoint to try to fix this new thing wasn't helping at all. So that's when I knew, okay, I have to look somewhere where I've never, ever looked before. And that led me into really studying more of the brain itself, because that's where pain resides, in the brain, but also the immune system, understanding the components of the immune system, which the biggest factor of that for me was the lymphatic system, which I know you're very familiar with, and the people study with you because your Chapman points, they're neuro-lymphatic points. Yeah. Extremely powerful in changing the nervous system and the lymphatic system. So once I combined that world with the musculoskeletal world, then my results really skyrocketed on changing me. But then that's where I started to have a lot of great success with the more challenging cases as well. And then my life at this point is to teach others, professionals and just everyday people, how they can find these answers themselves and things that they can do to help themselves. It's just understanding what in the world your body's doing and why you have all this inflammation.
Yeah. Can I ask you, because you said something before about that nutrition, like talking about drugs, etc., like the normal allopathic, and nutrition doesn't really, not really the answer. And I'm interested in that because we do know that the right foods will help with inflammation, but is it deeper than that?
Oh, it's always deeper. There's always another level. But listen, don't get me wrong. I mean, medications can really help a lot of people, and I certainly don't want people to suffer when they don't have to. Yeah. Right? And that I needed them for me. And nutrition is absolutely critical. Like if you're living on a diet of processed foods and sugar and fast food, and you're slamming down Twinkies and Yoo-hoos, you're going to be more prone to inflammation, autoimmune disorders, and immune system issues, period. And I think that that's just a heap of common sense, right? Yeah. But, a lot of that's what the world is right now, at least in the United States. I don't know about other places, but here it's absolutely horrific what our FDA clears to let you put inside of your body. Yeah. And then, but listen, the reason I can't understand there's more of it is because I have a lot of people, and it's better to eat good food than bad food, right? I think we'll agree with that. Yeah. But I have so many people that come in to see me who are following the really good. They've said, Doc, I've taken out the gluten. I've watched my glyphosates. I only eat clean, organic food, and I take all these supplements. And sometimes it's too many supplements, first of all, because you can overdo supplements, the 20, 30 supplements. And then they say to me this, they say, it maybe helped a little bit or didn't help at all, but I'm still suffering. Then you have to ask yourself a question, well, why? Yeah. Because it should help them to where they are. So yes, they're important, but there's a deeper level. And that is what we talked about before, is the autonomic nervous system, the nervous system. If that is, I don't really like to use the word dysfunctional at all, because I don't think really anything is dysfunctional. I think it's really functional. It's just stuck doing something way too much more than it should. Yeah. So it's a behavior that your nervous system has learned to try to protect you, and it's doubling down on it and using it way too much. So it's actually not dysfunctional. It may be what they call maladapted, where that's the game plan it goes to all the time because it worked in the past, and that's how the brain works. The brain just repeats things that worked for it in the past. It just does it again. So if your nervous system, for instance, if you're locked in what they call sympathetic dominance, hypervigilance, hyperarousal, fight or flight, hang on for dear life and don't die mode, no nutrition plan and no supplement in the world is going to help you for long, because your body is locked in survival mode. It is not going anywhere near the parasympathetic state, which is the vagal state, the vagus nerve. That's the recovery, regeneration, heal, and grow mode that you need to be in. And you cannot be in both at the same time, because I jokingly say that your brain only cares about one thing, and it's not happiness, and it's not having no pain. It's how about we don't be dead? Like, it's only concerned about the next 3 seconds of your life, because it's hard to heal and it's hard to feel better when you're dead.
Yeah, exactly. Yeah.
So why does that matter? This is really important. So why does that matter? Because when you're locked in sympathetics, you release all these hormones of stress, cortisol and adrenaline. And they're supposed to be up, but they're not supposed to stay there. They got to go back down. When they stay up, they begin to break you down. They wear you down. They actually eat away at you, and you become what they call catabolic, where you eat protein, you eat muscle tissue, you eat your gut lining, you eat your organs. Instead of being parasympathetic, that's anabolic, where you grow. The biggest reason sympathetic dominance is going to crush you is because it constricts the vascular and lymphatic structures in the body that move the fluids of life. So everything slows down. And when that happens, cells die. That's what happens. Straight up. So it doesn't matter if you eat great food or a supplement, that's better than a Twinkie. But if the blood flow is still constricted because you're locked in fight or flight, it's not going to matter in the end. And that's why the massage work can be so helpful for people, because that's a moment where you can help through touch and empathy and understanding where you touch in the body to help that sympathetic nervous system go down. So then they can have this moment where they can finally start to have this recovery in parasympathetic mode.
Yeah, amazing. And great comments with that parasympathetic versus sympathetic, because we do want to tick them through. So I've always said breath work is probably one of the easiest ways to get someone from sympathetic, because you can still be mindful versus trying to get into an alpha state where you're like meditation, or which is a bit tricky because your brain's still too busy. At least breath will work. I know that you're good into breath as well. What about some of the lymph stuff? Is there some of the there's a point just below either side of your sternum that will signal your parasympathetic, your vagal nerve. Is there what tips have you got to kick your parasympathetics in?
Yeah, well, first of all, I'd like to say excellent on the breathing. Yeah, that is the number one way, and the stuff that I teach, that you can control your autonomic nervous system by your breath. So just the very act of slowing it down, not breathing as much, because people usually over breathe like in a state like that. And then that feeds the fight or flight. So if you make really long exhales, you'll put yourself into a more parasympathetic state just from doing that. And like you said before, is that because when you pay attention to your breathing, what are you not paying attention to? The stuff that's stressing you out, right? So you're like, hey, look at this shiny little object over here. Don't think about the person that just cut you off in traffic or insulted you on Instagram, So it's like you you breathe it out. And then when you have that sense of control, the sense of control also decreases your stress because you feel more in control of your life and your body. Plus, don't even get me started on the wonderful physiology and the chemical changes that happen in your body because of oxygen and CO2. I mean, but breathing also moves your lymphatics a lot because it changes pressure with every inhale and exhale, and that pressure is kind of like a pump. So if we review the vagus nerve, a lot more people are familiar with the vagus nerve because there's so many wonderful things out there about it and research to say that vagal nerve stimulation can help decrease your stress and help your chronic pain and inflammation. Well, why? Because the vagus nerve, which is a cranial nerve that comes off the brain stem in the back, you have one on the left, you have one on the right. Pardon me. And it's the most important nerve in your body to control the inflammatory reflex, how your body reflexively acts in relationship to inflammation. And it takes you out of that fight or flight mode. So that's the one that kind of pulls the pendulum back the other way. So it exits from the brain stem in the back out of your skull. It goes down the sides, roughly the sides and front of your neck. It enters at the collarbone. It wraps around your esophagus, kind of like vines going up like a tree. And it exits down below the sternum at your stomach. And then it goes to the organs underneath there, because that's like the digestive tract area. And so whenever you do anything to the abdomen, to the sternum, to the collarbone, to the neck, you can really significantly influence the vagus nerve and its function. So if the vagus nerve goes to the gut, that's kind of like the longest nerve from the brainstem ends in the gut. So I always tell people your brain ends in your gut anyway. If you start to just massage in that region, it's usually going to sit right below the bottom of the sternum and like a couple inches down below. But I always go all the way down to the navel. And you just massage in there. You're going to start to wake up the vagus nerve, and most of your lymphatics reside in your abdomen and your gut. So you'll move those too. And people always ask me, well, why in the world would most of your lymphatics be in your gut? I'm like, well, because your body's really super duper smart. And we know that 70 to 80% of your immune system resides in your gut. So that's where you want to put the biggest part of your immune system, which is your lymphatics. So they can be there to clean stuff out. Yeah,
because that's what the role of lymph is, right? To remove toxins and
the lymphatics is the primary source to remove metabolic waste, cellular waste, bacteria, viruses, parasites, toxins, cancer cells. I call it muck. Muck is just anything that's stuck in your body that you don't want to stay in there for a long period of time, because if it stays inside of you, that's not going to work out well. You're going to get inflammation, pain, and you're going to get sick. Trust me, it's going to hit you at some point when that drained sewage system doesn't work well and gets backed up for you. So here's the thing you need to understand too. What happens if you're eating really, really great food and you're putting great supplements into a stomach and digestive system that's had poor blood flow for 10 to 20 years? Because you've been locked in sympathetic dominance for that long. Well, those aren't going to make that much of a difference. And I'm going to tell you this much. If you've had poor blood flow in that area for 10 to 20 years, you've had poor blood flow both ways, in and out, and your lymphatics are going to be stuck too for that same amount of time.
Yeah, yeah.
And that's why you got to clear that stuff out. So when people who do the massage work, really spending a lot of time around the cervical spine at the cervical 1, cervical 2. One of my favorite places to do any work at all, is the very first place that I start on anyone, is the collarbone, above and below it, at the thoracic inlet/outlet, and then all along the abdomen. But there's a lot of people who do massage work that honestly don't do abdominal massage or feel comfortable doing abdominal massage. And sometimes it's because they might not have been adequately trained in it, or it's cultural too. I know here in the United States, people get a little bit uncomfortable when you work around the abdomen. But when I go into Thailand and Asia and study, they dive right into your belly, 1, 2, 3.
Yeah, straight away. There's two things there. One, Melanie Allen was asking quite early in the piece, do you think body workers should be trained in trauma and psychology? Now, so Melanie, I would add one more in there, because trauma and psychology obviously is post-diploma. Like, don't just, there's no room in our scope of practice when we're first starting in bodywork to even think about it at that stage. So we're building blocks. But I think that we should have an extra curricular or post-diploma course in visceral work, abdominal work. Burrell, he does a lot of visceral treatment, but not even break it down to visceral, but just be mindful that working on the abdominal area is so valuable. And for lymphoma and lymphedema, sluggish, all the IBS,
Yeah.
it's really better.
But I'll be honest with you, listen, I mean, anytime somebody's breathing properly through the diaphragm, they're doing their own visceral work, because that moves your organs. So as long as you have your hands on the belly and you're doing everything very delicate and very light, that you're moving the viscera whether you want to or not. So you don't have to go deep and you don't have to go hard. One of the things that's changed in my treatment techniques over the years, because I've learned a lot more about the body and the nervous system and emotions and trauma and pain, is that my musculoskeletal treatments are always non-painful.
Yeah, yeah. And such a smart comment. Aubrey Gowing said, and take this on board, exactly what Perry said, don't make them painful. Aubrey says that if you're looking at somebody's body like you are, that they're a house, you don't break into somebody's house and expect that they're going to welcome you. Like, you want to knock on the door, actually ask to be invited in. Perry, you did that, doing that 6-spot mojo, which I'm going to get to. Yep, I was so sick, and I do eat quite well, blah, 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 blah. But I couldn't work out. I said to Ian, I think I've come down with something terrible, sinuses running, just scratchy, terrible, gone in 48 hours. But it was only after it left that I thought, oh, it's your fault, my friend.
Right.
Can you tell people that the 6, we got time? Can you rip through the 6 areas?
I'd be happy to. Yeah, the big 6 lymphatic reset is something that we've been teaching for many years, and honestly, at this point, it's helped thousands of people all over the world since I've been teaching it. And the basic premise is to work the primary areas of your body where you have a lot of stagnation. I like to use the word stagnation. Stuff just doesn't move well in the arteries, the veins, and the lymphatics, because they cluster together. So the lymph nodes in the body, in case people are not familiar with a lymph node, it's basically a kind of like a mini toilet that's designed to flush out waste, but it scans things that gets trapped in the lymph node for your immune system. So your immune system can start to kill the things that are trying to kill you, and it'll trap it. And you've got about 600 to 700 lymph nodes in the body that are strategically placed in certain locations. So these, I call them clusters or gatherings. They will be primarily around the joints of the body that are supposed to move the most. And why is that? Because we know that the lymphatics move primarily through a few different ways. Diaphragmatic breathing really moves lymphatics quite nicely. Human movement moves lymphatics quite nicely. And then people always say, Doc, what kind of movement? And my answer is yes. Just get moving. No. Walking is fantastic. Rebounding is great. Jumping up and down in place is great on your built-in rebounders called calves. And then your actually lymphatics have their own little smooth muscle pump that works as well, because if it didn't, you'd be dead when you woke up in the morning. So it's supposed to pump at night when you're sleeping. Now, usually people have a problem with all three of those where they don't work well. So these lymph node clusters are gathered around the joints because they're supposed to move, right? So they get clogged. Why? Because of tightness or tension and stress, and people don't move, and the fascia and the muscles get really tight and constricted in those areas, and fluids don't move. So they get trapped. So you have to just go in there and open them up. So we teach you the big sick sequence. And I always tell people the most important part of the big six is following the numbers 1, 2, 3, 4, 5, 6. What you do on the numbers is up to you. Like, I don't care what you do to them, just don't screw up the order. So number 1 is always at the collarbone, above and below. I'm going to tell you right now that I think that is the number 1 most important spot in the human body for tissue work, period. Not even close. Yeah. That's it. We have a YouTube video that we put up on the thoracic inlet where I show you the anatomy there. And by the end of it, your head will melt because you're like, wow, I had no idea how much stuff was in there. So you need to understand why it's so important. The reason it's important in my world is because that's the primary place where all of your lymphatics want to go. Okay. And a primary drain point for your veins as well, particularly from your brain. All right? Yeah. So if you're blocked at the collarbone, you're going to be blocked everywhere else, because stuff can't get out through the drain. You have to clear that first. Yeah. Yeah. Everything from IBS. Yeah. If you've got a blocked collarbone, I don't care how many supplements you take, you're not going to get over your IBS. I'll tell whatever it is in your gut, because you just can't. It's not possible. Because stuff is stuck. It's like trying to flush a toilet in your house that's got a blocked drain at the street. I don't care what you do to your plumbing in your house or how much money you spend to get your toilets fixed. You got to go to the street and you got to clear the block there, and then magically your toilet's flush, right? Yeah. Same thing here. So you always start at the collarbone. Number 2 is the largest lymph node in the neck, that's on the side of the neck on both sides behind the angle of the jaw. It's cervical 1, cervical 2. That's the primary node that's usually blocked on most everyone. So I see people blocked at 1 and blocked at 2, and they have a lot of pain. Exactly right there. Pretty much right in front of the sternocleidomastoid point, right at the ear, right there. So number 2 will drain down to number 1. So that's why you start at 1. Now, number 3 is the shoulder joint. That makes sense, right? Because you're supposed to move your shoulders a lot. Yeah. But humans don't do that. We sit rounded forward holding a phone where everything is flexed forward, and we never put our hands over our head. And when we walk, we don't walk with our arms, because doc, I can't walk with my arms because I can't see my phone. You follow? Like, so they're not walking, and they're usually, so everything is stuck right here. And then when you're in the massage world, everybody has tight pecs, right?
Yeah.
So 3 will drain to 1. Now number 4 is the whole abdomen, from the navel up, the whole thing, but particularly right in the middle, because that's where the lymphatic channel sits, and that's where the largest lymph node in the body sits, right between the navel and the bottom of the sternum. That's the biggest block, right? Then number 5 is the crease of the groin, called your inguinal region. And that blocks too. Why? Because people sit all day. So they clamp down on all the lymph, but not only that, but all the blood flow to everything in your legs.
Yeah.
Because that's the only place it's coming from. I got news for you. That's it. And then number 6 is behind the knee joint.
Yeah.
And that gets locked too. Why? Because people sit all day and they flex the knee. And they don't walk, so they don't use their calf muscles. And they usually have a lot of tightness in their calf. And because they don't walk and they don't move, they have tightness and restriction in the ankle joint and the plantar fascia. So your vein pumps and your lymph pumps and your calves, they're on vacation. They're just having a margarita on the beach. They're not doing anything. And that's the primary pump to move things down in the legs back to your heart.
Yeah. Question, because I love all this, and in a minute we're going to flick over to a little bit of a video for the sponsors. But rotten hip, rotten opposite shoulder, could people just like obviously start with 1, 2, but could they be focusing on those 2 points to help improve the quality of those joints? Or I'm asking for a friend.
Yeah.
Like just spend a little bit more time on those areas. So if you're doing the 6 and you're spending like 30 seconds in each area, maybe 2 minutes in each of those spots, or can we use that as treatment for musculoskeletal pain specific like that?
Sure. Yeah. When I teach my body workers, I always tell them, in the perfect world, I'd like for you to open up the big 6 before you start to do any of your other body work.
Yeah.
And then people ask me why. Well, because I'm like, you're opening up all the fluid pipes to all the muscles that you're trying to help.
Yeah.
Right?
Yeah,
so if you clear the pipes, then when you go on the areas and work the body, you're going to get better results, because now fluid's going to move into things and out of things better. So as long as you do the order, and you always do all 6, you don't just go, hey, I'm just going to rub spot 3 today. No, you have to do 1, 2, 3, 4, 5, 6, and you always have to do both sides. There's no such thing as isolated lymphatic work in my world, because the whole system communicates with each other. But let's say, for your example, there's going to be that's a large joint, and you have large muscles around the shoulder and the hip. So you'll probably want to park and spend a little bit more time in those regions than the others. But you also have to adhere to the rule that more isn't better, better is better.
Okay,
so
that's fine. More isn't better, better.
Well, you can overdo anything, right? So people always ask me, how long should you do it? And my answer is enough. And I don't say that to be flippant, but I say that because it changes. For some people, it may be 30 seconds. For some people, it might be a minute. But what is non-negotiable is 1, 2, 3, 4, 5, 6. You don't do 4, 1, 3, 6. You don't do that. Okay.
No, because you're taking up the parts, right?
Yeah. And well, the reason you do that is just because it's the laws of physics. So there's a physics of fluid flow is called hydrodynamics. when you're talking about veins and lymphatics, high pressure fluid will always try to find the low pressure route. So it's gonna, when there's a lot of fluid one place, it's gonna find where there's not much fluid. Does that make sense?
Yeah.
So the lowest pressure for the vein flow and the lymphatic flow in the whole body is the collarbone. So everything in your body is trying to find its way there.
Okay.
So you have to work from low pressure outwards towards high pressure.
Mm.
So that means you don't start doing things in the feet. You don't start doing things in the hands. You do 1, 2, 3, 4, 5, 6, and then you can go to the feet. Then you can go to your hands, because you have to open up the pressure systems in order. Otherwise, you're going to get backflow.
Yeah.
And when you get backflow, that's not going to work out well. You're going to have a bad response to that.
Yeah, no, that's yeah, and very revolting. What we're going to do is we're going to flick over to a quick sponsored message by Q Academy, and then I'm going to get Perry back and talk about what he's got going on in the future and what kind of opportunities you guys can do to get into some of his courses. But first of all, let's jump into Q Academy.
My name is 𝗀𝗶𝗀𝗃. I studied Cert 4 massage in 2014 and then went on to remedial in 2015. I was working in ASICS. I was retail, Lorna Jane. The real reason why I went and studied was my daughter was, she's been quite sick for about 7 years on and off. She's had a couple of chronic conditions. So I found it hard working in a job and having to leave because my children are sick, or I've got to go to hospital, or there's just so many things going on. For me, I needed another option. I've been set up for about 8 years now, working from home. Having a home business has been like such a blessing to my life. I don't think I could have done what I've done somewhere else just with my own circumstances. My life's very busy. I've got 3 kids. And this year has been a little bit different again because now I've got 3 kids playing sports every afternoon. So I do try, if I can, work in between school hours. I feel like you can make it work to your advantage. So you can either work as hard as you want and be stressed and all the things, or you can make it flexible.
And I'm just thinking to myself, I wonder with that chronic condition, if she had have known about doing lymph work, how would that help?
Well, that's the first thing I always tell people. The lymphatics are the first body system that I check to make sure it's good, make sure it's clear. I haven't found one yet that's been clear.
Oh, God, that's a bit terrifying. So I would love to talk forever and ever and ever with you because you are amazing. And you did say something about why you moved from chiropractic to transitioning. So we've kind of covered that it was just only bone versus, not that it was only bone, because chiros are neurology as well, right?
Yeah, well, things have changed a lot over the years for sure. And you can get training in school and you learn chiropractic, which is mobilization of joints, but we do soft tissue work as well, many different techniques on muscle, fascia, ligament, and you'll usually get your training after school if you wanted to go into the world of neurology or functional neurology and things like that, which I did. I mean, I've studied a lot of different disciplines of a lot of different body systems for sure. And you can even study lymphatics when you get out of school. They really won't teach you anything about it when you're in school, to be honest with you. They'll breeze over it. At least they did for me. I don't know if it's any different now, but I highly doubt it. But here's the thing. People get the training in those things, but they go after these single systems. You can't do that. There's no such thing. all of these different systems talk to each other. They communicate with each other, and they never work alone. And it's never just one system issue. It's like a little bit of a lot of them trying to help each other. And so that's why you have to study the systems. But here's the part that takes the most work. You have to understand how they work together.
Yeah.
That's the physiology side, right? So when you can begin to think like that of, okay, let's say, for instance, you're, and this is the thing that I was looking at. So I was always working lymphatics when I was doing my musculoskeletal work, right? But you just can't not work lymphatics. But I didn't know that I was working lymphatics because I wasn't envisioning lymphatics, but I was just rubbing body parts and trying to help things feel better, but not understanding of where are things moving after you touch it.
Yeah.
But you really have to understand that, because it makes a difference on where you start and where you end, especially when you know how fluids move, but how the nervous system responds to touch and things like that. So for me now, my whole work is helping people understand all these systems, and I teach them about the systems. But then what's the approach of how you can begin? Where in the world do you start?
Yeah.
And then we said that in the beginning. So I'm going to tell you the biggest things that I focus on when you come in to see me. And when I do massage work or musculoskeletal work, I'm only thinking about it in relationship to how it influences these things. One, I have to calm the body down and balance your sympathetic and parasympathetic nervous system via vagus nerve and sympathetics. That's number one. Okay.
Yeah.
Then number two is going to be the blood flow and the lymphatic flow. I have to get those things balanced and better. Those are my top two. So it's calm the body down, move the fluids, then the healing process can take place, because if you don't have those first two, guess what cannot happen? Healing.
Yeah.
So if you're like a massage person, you can use it's such a powerful thing that you have here. You can use that to do those very things. Calm the person down, and you'll move fluids better than anybody when you do it. So that's the beauty of this. So anything that I do, because listen, there's a billion things you can do therapy wise to try to help somebody, and they'll all work. But all of those things only come after I make my checklist off on the first two things, because I know this much after being in this thing for 30 years. If you're stuck in fight or flight, you're not going to heal no matter what you do, period. If you have poor blood flow and lymphatic flow, you're not going to heal no matter what you do. That much I know.
And we haven't talked about flow at all. We've talked about the other two. Are you running courses that you actually can teach therapists how to be considerate of the arterial and venous flow as well as the lymph? Or does it hand in hand? Yeah.
So I do teach I teach a lot of courses for sure, and usually individual ones on each system. Then I show you how to mix them all together. But there's a lymphatic course that we teach. But here's the thing: when you work lymphatics, are you working blood flow as well? Yes, you are. But the techniques are a little bit different, and the approach is a little bit different on how you do it and where you do it. So, but then we teach the blood flow part to make sure that that's why we do lymphatics first, because the lymphatics and the veins work directly together. So I consider lymph and veins the same system. because the lymph dumps into the veins. So you've got to get the stagnation and the muck begin to move and get out. Then you can go back and stimulate the arterial side. That's the supply side that comes in. And then you have to understand how those flow routes work. So for instance, if you have inflammation or pain in your right foot, then what I'm going to ask you is, what's the sympathetic nerve innervation for your foot? And you better know it. Okay. And then what we're going to do is say, okay, where do the lymphatics from your foot go? And that's where you would point to your collarbone. Right? Yeah. And then I would say, where does the blood supply to your foot come from? And that's where you would point to your heart. Yeah. And then you have to know that whole route. And what you have to do is you have to be able to check the whole route. And in my world, what that means is this: do not start rubbing your foot first.
Yeah. Yeah. Totally makes sense.
Right? Because what if stuff can't get out of your foot, and what if stuff can't get to your foot? Rubbing your foot's not going to help you that much. Right? So you have to be able to check the routes. And when you do that, and then when you go back and you treat the foot, what you'll typically notice is this: holy cow, man, that foot really recovered quick. Like it felt better. And I make it easy for you. One of the things you can do is do the big 6, then go to the foot.
Yeah. Yeah. Reassess. Exactly.
Yeah. Because the big 6 clears your routes for you.
Yeah.
Right. And when at least here in the United States, when I work with massage people a lot, they usually start their massages with people prone, face down.
No. Yeah.
And I'm like, no, you don't want to do that, because it's all your supply pipes are on the opposite side. So you work on the front side first, and then you go to
everything. Yeah, exactly. I know they shouldn't even teach that in college, but I suppose that they do that because it's the old Swedish massage kind of paradigm that.
I think it's cultural too. Sometimes, honestly, like I mentioned before, that could be as well. I mean, maybe it's changing, but listen, I did that in my world forever, because as a chiropractor, I'm trained really to treat your spine. So the first place that I would place you is, you can lie face down on the table. Yeah. Now I'm thinking to myself, what are you, bananas? Like you gotta check the other side first.
Yeah. Yeah. But people love to dive on the table. My thought is that if you're an exhausted, tired person, you want to dive front down because you're protecting your organs. You're hiding them. They're being nurtured, lying on them, and you just want to fall asleep, or you just want to be in someone else to take control of my life for an hour. And that's where they go. And they get a bit testy when you go, yeah, hang on a minute, I want you lying on your back first to start with. And they're like, you're breaking into my comfort world. But so we've got to actually give them, the second you touch them, they start feeling good anyway, in my experience. But we do have to break that for me, that means breath work. That means calming the body, calming the mind, getting them into a space where they feel that they're supported.
I think that's an excellent point, and that's why this work has to be very individual, because of what you said before. People are very vulnerable about the front of the body, because that's all where everything sits, that if it gets taken out, you die pretty quick. So that's why you curl forward into a fetal position to protect yourself whenever the world's coming at you. And they may not be ready to be put over on the back, because that's a very vulnerable position, especially if your legs are straight and not bent up. But that also comes from experience, where you'll notice that for people. And you know, sometimes the approach of going on to the back is necessary in the beginning, and that's okay too, because listen, it's not like if you start on the back that you're gonna reverse the plumbing and then somebody's gonna be worse than when they got off. It's not that. It's just that when you're dealing with somebody who has, because you have to also keep in mind the kind of patients that I treat.
Yeah.
I see you when you're in the quicksand and you got one finger out before you sink, like you're in a really bad spot. So I automatically have to deal with a person in a specific way because I know they're in that state. So these techniques that I use for them, that's my world. I may not necessarily use that if I have somebody coming in to see me who's like hashtag beast mode monster athlete, just wants to go harder, faster, stronger, longer.
Yeah.
But listen, you got to be careful with that too, because just because you have great eye candy on the outside doesn't mean you're a complete hot mess on the inside with inflammation. You're just covering it up because you got a nice paint job. I don't know what's underneath until what? Till I get my hands on you.
Yeah, exactly. Yeah, and you know, this is a good learning curve for any therapists who are new in the profession, because we're taught to go prone, and that's totally fine. But at some stage, you need to decide whether you want to be a master in your industry or you want to be just a benefit to everyone who comes in and offer a lovely soft tissue massage that is going to massage their nervous system anyway, because of touch, affect, etc., that Perry said before. But if you want to become a master and a guru at it, then people are coming to see you because they want you to help them find a solution to their pain. And that means we're not going to start prone. We're not going to start in a system. We're going to start by listening to you and then applying the best treatment. And I would say, like, for me, it's always been sympathetic, like get the nervous system sorted. I'm now heavy into the lymphatic as well. Neurolymphatic works my jam, as you know.
Oh yeah.
But also doing just specifically for getting the muck out of, draining the dunnies.
Yeah, that's so well said. I mean, once you develop a trusting kind of relationship with the patient that you're seeing, then you can move them into the work that you know that they need, but you meet them where they are. And when you become the master, or when you know this is the way that's going to be best for them, trust me, people are going to find you. That's how it works.
Yeah, absolutely. Perry, it has been, I've loved every second of this. If people want to do courses, they go on your website, right? There's the Mojo.
Yeah, Stop Chasing Pain is the central hub for everything. We have all of our workshops listed underneath. Coming up for the remainder of this year, we have our Eye Mojo course, all about the eyes. And then this month we have our advanced called Lymphatic Mojo, how to help the advanced things for the meningeal lymphatics of the brain, and the advanced brain head neck course. That's this month too.
Just light stuff, guys. No, I'm sure Perry will break it down so it's really simple and easy to understand.
It's easy peasy once you know. Don't let that easy peasy. You got it.
I'm scared of everybody have a great time with this. Please, I encourage you to go onto his website, because there's drop downs and there's free content like falling out of that space if you want to learn about little bits and pieces. Do courses, like develop your brain. You've all got to do your continued professional education stuff. Use it wisely. Just don't do some boring ass thing because you think it's going to be easy and you'll get your points from your association. Go and do stuff that's mindful, that will help you and help your clients and patients. So, Perry, thank you so much. It's been,
thank you.
It's been great. Everybody, next month we've got my mate Tom. I've just lost his last name because my brain's fallen out, from the UK, and he's all about athletics, etc. So watch for that space, and you'll see that on my website about when that's coming through. Perry, delightful yet again, and have a Merry Christmas, everybody. And
yes.
And happy whatever, because we're getting there closer. All right. Thanks, everybody. See you later.
Bye.